us to reach 2030 and the goals we've set for ourselves, the speed cannot be the same.
3 days of deliberations on the best ways to foster universal health coverage on the continent by 2030 is the Africa Health Agenda International Conference that took place right here at the Kigali Convention Center and convened over 1,500 participants from across the world. Discussions centered on access to quality healthcare, but most importantly, financing. My name is Stephen Muvunyi, bringing you on behalf of CNBC Africa highlights from this particular conference. With increasingly thriving and fast-growing economies, Africa is taking the upward direction, feeding hope for a bright future of the continent. High attendance of the Africa Health Agenda International Conference reflects public and private sector actors' will and recognition that prosperity won't, however, be realized if people aren't healthy. As the continent strives to achieve universal health coverage by 2030, experts make a strong case for a robust healthcare system at a primary level as the prerequisite to realization of this ambition.
The healthcare needs that we need as Africans can be met through primary healthcare. So if we just invest in that, you can imagine it's just 20% that is needed for tertiary and secondary level. So if we invested in strengthening the primary health care systems, we have solved 80% of the health problems that we have in Africa. There also needs to be a shift so that we can recognize community health workers who are a very strong component of the primary health care system.
I believe and my government believes that primary health care is critical. And when I look at community health workers, actually for me those are doctors at the ground level, at the household level. And today we have increased the number of community health workers from 45,000 up to 58,298 community health workers. That means one community health worker is taking care of 27 households. This is universal health coverage.
I believe that the down-up approach, the upward approach is really the way to go. Whereas from the top, we have policy, direction and all that, but at the community, this is where the game happens. If you train them, if you give them the right training, the right resources, the right equipment, and the right follow-up and mentorship and guidance, that is very sustainable because this person is rooted in the community. They're not going to go away.
The second edition of the conference brought to light challenges hampering universal health coverage, and financing stood out as the most worrying. Africa's health sector is largely underfunded despite commitment by governments to increase health budget to at least 15% under the Abuja Declaration. This leads to costly health care, which rolls back efforts to achieve universal health coverage.
30,000 people will enter the poverty bracket today because of health costs. 30,000 in Africa. Today we'll move from $2 to below $2 because of health costs. Some of those are our neighbors. Some of those are our relatives. Some of those are our children, our parents, who will move from where they are to poverty because of health costs today.
About 400 million people go into poverty each year because they have to pay for health care. Now, paying for health care, because of its impoverishing nature, becomes an issue that countries should commit themselves to assuaging, especially in regards to the debilitating effects of spending on health care.
I'm here for us finding more financing that is not reliant on aid, to forward all the agendas that the Ministry of Health is setting for us.
It is estimated that Africa needs at least $25 billion in investments to meet healthcare demands. It is believed that these and other efforts aiming to transform healthcare on the continent will hardly be achieved if everyone is not involved.
The goal for all of this is to reach UHC across Africa, across the world by 2030. And a big part of that is primary health care. And one of the ways that we're working to achieve that, in Rwanda in particular, is through private-public partnerships at the primary health care level.
Civil society today can help us with advocacy, with community health influencing and promoting, with holding leadership to account, with actually holding the system to account, and also by measuring the impact. So if we can get the right partnerships, you know, it can be a delicate balance keeping the independence of civil society, but at the same time having civil society knowledge factoring in to the policymakers' knowledge.
The resources are limited and government doesn't have enough funds to provide the demanded healthcare for Africans. This means partnership with the private sector, development agencies, and other stakeholders is critical. Now, if you look across Africa, I don't think some of the countries haven't really created strong partnership bonds, and they feel we should run with the healthcare system ourselves. It should be public-driven, public-led, and probably only public system. That's the beginning of failure.
If employed, technology would offer a significant boost to universal health coverage by making healthcare more efficient, according to experts. Technology should therefore never be overlooked.
The government of Rwanda is doing a lot in terms of bringing in more universities to train more doctors, building more health facilities and so. But when you look at the growth of the population, you tend to feel more desperate about how are you going to bridge that gap. You can use technology to bridge that gap faster. With building a health center might cost a couple of $1 million. Using a call center with the same kind of staff, you see more patients than you see in a health center. So you actually bridge that gap and you go towards reaching universal health coverage.
In the field of healthcare, there's been lots of very interesting innovations. And so recently we are seeing innovations like these Da Vinci robots, which are surgical robots that is used to perform like minimally invasive procedures. And so, I mean, these are actually being deployed in many hospitals. So robotics is going to play a key role in the health sector and is going to improve life, is going to bring better like healthcare delivery to people.
If you are using data properly, even though different programs are run by different sectors, still, to mobilize all the capacity, you have to have the real data to see the real change and also implement other different policies.
Youth and women constitute a bigger percentage of Africa's population, and involving them should be nothing but a must.
But when you really look at the health sector, women are the ones driving health in their communities. They are the change agents. They are the leaders in their communities. They're the brave ones at the front lines. Particularly when you look at the health workforce, 75% of the health workforce are women. And when you look at leadership, only 25% of leadership positions are occupied by women in academia, in private sector, as well as governments. And so really, women in health are often not really looked as the leaders they truly are.
When you invest in girls and women, when you invest in their health and their rights, there is a strong, strong ripple effect that affects everybody, and everybody wins. If we want to see better health, more wealth on the continent of Africa, we need to invest in girls and women.
Universal health coverage is supposed to be a decent standard of health coverage for all. And I think if we can make our policymakers, as we say, the duty bearers and the decision makers, respect the woman, respect the girl, respect the youth, and respect the men and the family around them.
I'm a mental health advocate, so I'm always looking out for the involvement of youth in making policies, in influencing change, and being at the key, at the key part, at the at the forefront, that's the word I was looking for, the forefront of decision-making processes.
Discussions at the conference laid out preconditions to the accomplishment of universal health coverage. But how realistic and achievable is this? Awarded the champion of universal health coverage by AMREF, Rwanda was described as an epitome of what's possible.
It is very much realistic. If a country that had almost no health system back in 1994 has universal health coverage, we have about more than 90% covered by insurance. If we could do that, everyone else could do it.
It is possible. We are in an incredible century. The things that we can achieve, we are talking about the magnitude of digital health, artificial intelligence, and what we can even do on just, our fingertips with a cell phone is remarkable. When I was growing up, that wasn't the case. We still had to use dial-up internet. And so I think universal health coverage is completely achievable, but what we need to do is have the political commitment, the financing, and really have all the bright, diverse minds, which includes women and girls and young people at the forefront.
I was very surprised the experience from shared in the plenary session, especially from the Rwandan primary health coverage system, how they were implementing the last years, even this time, because of the performance indicator measuring. I was surprised how they are implementing this measurement process from the upper to lower level. I think this helped them to reach the primary health coverage system.
My favorite thing about Rwanda's healthcare sector is how integrated primary healthcare and how diverse it is. So we were actually just talking about it yesterday, that NCD care has now, non-communicable diseases have now been integrated into primary healthcare. That's a first for a lot of countries, and the way that it is done, the importance that it is put into is very indicative of what Rwanda is as a country and how far we are going as a healthcare, in healthcare. Yeah.
It's the third and final day of the Africa Health International Conference that has been taking place here in Kigali. A lot was discussed, but the most notable of highlighted issues hampering universal health coverage is insufficient financing. Concrete government action and partnerships were put forward as key steps towards achieving this particular ambition. My name is Stephen Muvunyi. Thanks for watching.